In this video, you're going to learn 5 tips on how to get rid of back pain in the best way possible, caused by muscle tension, herniated discs, and sciatic nerve issues. But stay until the end of this video, because in tip number 5, I'm going to show you the best remedy that science has shown us to treat back pain. And the best part is that you can get this remedy for free without paying anything for it. I'm a physical therapist and I treat countless patients with back pain. And in this video, you're going to get the same tips that I also share with my patients. And before I talk about remedies, I want to talk to you about surgery. The first tip I'll give you: if you have a herniated disc, don't get surgery. Take a look at how a herniated disc behaves. Here we see the nucleus of the disc, shifting and compressing the nerves that come out of the spine. That's where that radiating pain with tingling comes from. Like in the case of a herniated disc, some studies show that in the vast majority of herniated discs, the herniation actually returns to its original place after conservative treatment without the need for surgery. In the United Kingdom, that number reached 82%, meaning out of every 10 people with a herniated disc, 8 of them experienced spontaneous reabsorption of the disc. That means the herniation disappeared and these people didn't need surgery. This shows that, in the vast majority of cases, conservative treatment is going to be the best option. So, if the first doctor you went to wants to do surgery, if surgery is his first and only option for you, in cases of back pain, in cases of herniated discs, in cases of sciatica, look for the opinion of a specialist who is more conservative than that. Seek even a third opinion if necessary, but don't have surgery before trying several alternatives and conservative treatments, because in most cases, as you've already seen in this study I presented here, with conservative treatments, the herniation has the ability to return to its original place. Can you be cured this way? So save this video somewhere so you can come back here every day and repeat these tips with me. And don't forget to give it a thumbs up. Subscribe to the channel. We have a goal to reach 100,000 subscribers, so I'm counting on your help. Subscribe to the channel. What are you waiting for? Go ahead and subscribe. Go ahead and write it. I'll wait. Tip number 2, the second tip on how to relieve lower back pain might sound silly because it's so simple. You need to drink water. You need to stay hydrated. About 80% of the composition of the intervertebral disc is water. These discs act as shock absorbers for the vertebrae in our spine, like a water pouch that's there to absorb impact, to create congruence, allow for gliding, and to keep your spine healthy. These discs need to be hydrated. Here in this MRI scan, which is the test I order, to investigate the causes of lower back pain, you can see, right there at the red arrow, a herniated disc. And notice that this disc looks darker compared to the others, in A, black in pattern. This means there's no fluid in that disc, so it's dried out. Anything that's fluid in this type of image on this MRI scan we see is white, so notice how the discs above are white on the inside, meaning they're healthy and hydrated, while the diseased disc, pointed out by the red arrow, is dark and dried out because this patient needs to start doing this along with other alternatives. One of them is to stay hydrated, drinking at least 2.5 liters of water a day, and then start doing some physical activity like walking or aerobic exercise to increase blood circulation and help get water into that disc. Good. Now, here are some of the medications I prescribe for some patients with acute lower back pain. Acute pain check. When the patient is experiencing a lot of acute pain, meaning pain that started just a few days ago, it's possible that the patient will need some medications, painkillers, anti-inflammatories, and muscle relaxants, so they can treat the problem with the minimum necessary, the pain that's manageable within physical therapy. And there's a possibility that this patient could take a medication that already combines all 3, like Tenderlax, Torsilax, Infralax, or Miaflex A. And since the vast majority of people who have back pain also have some associated muscle pain here in the lower back area, especially, that's because the muscles, as a protective response, become hyperactive, tightened and contracted to try to protect the spine. And this ends up increasing muscle pain, and a natural muscle relaxant is simply to use hot water compresses. I usually prescribe at least 3 compresses a day. For these patients, 20 minutes per application. If there is any reason that prevents the patient from using the medication, for example, athletes, patients who exercise, patients who have stomach problems, or even patients who are allergic to any component of these medications. In this case, the person can use a topical anti-inflammatory like a patch, ointment, cream, or gel, such as Cataflam, or even Arnica itself, which is an herbal anti-inflammatory. If the person has associated nerve pain, like, for example, sciatic nerve pain, the doctor may prescribe some medication with B-complex vitamins like deoxycytinurine or alginate, in addition to painkillers and muscle relaxants, because those also help with that nerve pain. When the patient reaches the stage of chronic pain, that is, after 12 weeks or 3 months from the onset of symptoms, that's usually when most of my patients come to see me. We try to prevent these patients from continuing to take medications because these medications, especially anti-inflammatories, have various side effects, putting extra strain on the stomach, kidneys, and so on. By the way, leave a comment below if you clicked on this video because your pain is in the acute phase, meaning it's just starting, or if it's already in the chronic phase. From 12 weeks I read with great care. All your comments here on YouTube. A patient in the chronic stage can, for example, have some tramadol kept in their wallet or purse for cases of severe back pain or sciatic pain attacks. This patient can also use gabapentin or pregabalin, which are medications that work more on a neurological level. But in my opinion, the ideal scenario is that from the very beginning of symptoms, the patient treats this pain in a conservative way, using as little medication as possible, or none at all if possible. A very interesting option in this case is the use of oral herbal medicines, such as turmeric, also known as curcuma longa. This type of herbal remedy can be taken, and can be used safely over the long term because it doesn't have side effects. I really emphasize this point to you all in these videos. I've repeated it countless times in other videos about a study that compared turmeric with diclofenac, and this study showed that turmeric, when used 3 times a day, provides the same therapeutic benefits of diclofenac. However, turmeric does not have side effects, and as I mentioned to you, it can be used for a prolonged period without risking harm to your organs. In fact, even if you don't have any pain or any injury, you can still use turmeric to naturally reduce inflammation in your body and prevent future problems down the line. Turmeric can be consumed in capsule form. You can eat the raw root directly. This root can also, it is grated, it turns into a powder. You can use this powder and use this turmeric powder as a seasoning in your food. You can make turmeric water. There's a video here on my channel. A video with the recipe for turmeric water with therapeutic properties, anti-inflammatory properties. There are several ways you can consume turmeric so you can incorporate it into your daily routine. Fun. Last but not least, the best remedy for treating back pain. This remedy is not a pill. Did you know that science shows us that people who have back pain have tighter muscles in their back compared to people who don't have back pain? The muscle, when it's in this condition, it needs to be stretched through exercises. That little pill you take doesn't stretch your muscle. So, even if it masks the pain, even if it hides the problem, it's not treating the root cause. You need to get hands-on and stretch your spine. There are exercises that are perfectly safe, low impact, that I prescribe for my patients to do at home for treating back pain. And in this video, you're going to learn what these exercises are. I live myself. Do these exercises because sometimes I get a little back pain too. Then I need to do these exercises and the pain gets better right away.
But okay, doctor, you keep talking about surgery, MRI, pills. When am I actually going to learn these exercises?
Hold on, you're about to learn right now. Take a look at the first exercise. Check it out. You're going to do this lateral mobilization of your torso with your arms wide open and moving your legs from one side to the other. Now stand up and do trunk rotations, moving your torso from one side to the other, trying to make these movements here more smoothly. Now you're going to do this next exercise with a light gym bar, no weights, or with a broomstick, as if you were doing the stiff leg exercise, with your knees straight and squeezing your glutes. So you lower yourself while exhaling, and come up while inhaling, taking a breath in, and do this for 3 sets of 10 repetitions. Now lie down on your bed or on a mat on the floor, and do this bridge exercise also for 3 sets of 10 repetitions, because activating your glutes is extremely important for you if you have back pain. For those who have sciatic pain, I do not recommend this stretching exercise because it's harmful to stretch an inflamed nerve. Instead, I'm going to show you this dynamic mobilization now, stretching the muscles behind your thigh. By doing this, you're mobilizing your sciatic nerve. It's a great exercise to treat both the sciatic nerve and back pain. Now, the cat-cow exercise has a funny name, but it's also great for this purpose. Do these 2 positions, first looking up with your butt staking out, and then looking down with your butt tucked in. inhaling and exhaling as you move from one position to the other. Lastly, do this exercise here. Now, for the rotation exercise, lying on your stomach. Rotate your torso along with your lower limbs. And these are some of the exercises I prescribe for my patients with lower back pain. If these exercises helped you, don't forget to give it a thumbs up, subscribe to the channel, and leave a comment below if it helped you. And if you want to know everything I think about back pain, about how I treat this pain in my patients, I'll leave a link here for you to click. There's a playlist with several other videos, and I'm sure that after you watch all of them, you'll be much better informed. Don't forget to click and watch. I'll be waiting for you there.